was 6 years old, I went on the biggest adventure of my life. My parents, grandma, brother, and I flew halfway around the world to China and stayed there for 2 weeks. As much as the trip was enjoyable and interesting, though, our purpose was a lot bigger than just sightseeing, because when we came home, our baby sister, our 1.5-year-old Amelia, was with us. We were so excited about the adoption, but something unexpected happened. Can you imagine being 1.5 years old and flying halfway across the world with a family you'd barely met? That was probably why she lost all of her speech. When I was talking about this speech with my mom on approximately October 7th, 2021, she said she didn't know where her lips were or that they made sound. My sister and her therapist had to start over completely, so speech therapy or speech pathology has been a part of my life for many years. And in my informative presentation today, I would like to tell this audience of Communications 110 students about speech therapy. And more specifically, I would like to tell you about 3 things. Firstly, about career paths a pathologist might follow. Secondly, reasons why a patient may consider speech therapy. And thirdly, strategies that therapists use. And now onward to my main points. And here in my first point, I'd like to tell you about various careers in speech pathology. And there may be many more than you might realize, and those do include pediatric therapy, working with little kids in a school setting, and that's what I would like to do. But the American Speech Language Hearing Association, also known as ASHA, also lists in the article Employment Settings for SLPs the following categories. This was accessed October 9th, 2021, and they mentioned the categories colleges and universities, healthcare, hospitals, which would be cognitive communication languages disorders and providing counseling to parents and their families. That was a direct quote. And private practice, corporate speech language pathology, and others. A speech language pathologist's job also depends on their college years, because only therapists with a master's degree are licensed for practicing therapy without being watched by someone with more training. So in this first point, I have told you about various careers that a therapist might have. And now in my second point, I will tell you about reasons a patient has therapy. These may include things like stuttering, stroke, cleft palate, and Adrienne Santos Longhurst in the article What is Speech Therapy, accessed May 9th, 2019, lists the following: articulation disorders, fluency disorders, and, along with others, expressive disorders, which she describes as trouble forming accurate sentences, such as using incorrect verb tense. It's associated with developmental impairments. As you can see then, there are many reasons therapy is used, not just in typical situations like stuttering or lack of speech, although those are cases also, as in my own example with my sister who did lose her speech. These different situations are also caused by different factors, and the unknown author of Speech Language Therapy, accessed October 11th, 2021, lists hearing impairments, weak oral muscles, developmental delays, and traumatic brain injuries, among others, as, I paraphrase, causes for a child to need speech therapy. So in this point, I have told you causes for therapy for a patient. However, no matter which reason a patient brings to a therapist, the therapist will need certain methods they employ to treat that patient. And that's what I will tell you about in my third and final point: popular strategies, or just strategies that a therapist may use. One source that I personally think is good is Leah Curtin's 25 Speech and Language Strategies, accessed October 7th, 2021. It's a chart with 25 short tips, such as one she calls Be Forgetful, and then adds Let them ask for what they need. The advantage to this resource is that the descriptions are helpful, but not necessarily specific. So they can be used for many different children, and there are enough ideas for the therapist and parent of the child to pick and choose. Written by Jackie G., last name unknown, Essential Speech Therapy Activities and Techniques, published November 7th, 2012, also suggests Speech Buddies tools, which I quote, devices customized to individual sounds that are inserted into the mouth to provide a target for the tongue. Depending on the client situation, the techniques discussed here may be some a therapist would use. In my informative presentation today, I have told you about something very important to me, speech therapy or pathology. More specifically, I have told you about situations in which a therapist might work, why a patient would have therapy, and what the therapist may do to help the patients. I hope you have learned why therapy is so important. Here are some more recent pictures of my sister, and therapy has certainly been important in my life because now my little sister can not only make sound but can speak English fluently. Thank you.